Hello, my name is Katrina Holland, and today I'm going to present findings of our study into the impact of the COVID-19 pandemic on access to veterinary care in the UK. In order to control the COVID-19 pandemic, many countries imposed restrictions on the movement of their citizens. In the UK, following a period of advisory isolation and social distancing, lockdown measures were formally announced by the government on the 23rd of March 2020. During the strict lockdown period, people were permitted to only leave their home for essential reasons, including to shop for essential supplies such as food and medicine, essential work where remote working wasn't possible, medical needs, and to only take one exercise outing away from home per day. Guidelines for veterinary work were published by the British Veterinary Association, outlining that for the period 23rd of March to the 14th of April, only urgent treatment and emergency healthcare were permitted. During this time, there was an 80 to 90% reduction in veterinary consultations, whilst vets were seeing emergencies only. Restrictions on veterinary work were relaxed on the 14th of April, and by September, veterinary caseloads had returned to normal. Previous studies have explored dog owners' experiences in relation to healthcare seeking during the initial months of the pandemic, but the longer-term impact remains unexplored. Therefore, this study aimed to firstly explore dog owners' concerns and experiences related to accessing veterinary healthcare, and describe owner-reported ability to access veterinary services, all during the first 8 months of the pandemic. The data for the study were collected using 2 surveys and electronic diaries that were designed to explore the impact of COVID-19 on dogs and their owners. The first survey collected data between the 4th of May and the 7th of July, while the follow-up survey was open between 5th of October and 4th November. In addition, we collected open-ended entries to diaries administered to the general population and Generation Pup cohort. Generation Pup is an ongoing longitudinal study of dogs with an existing diary feature enabling owners to make notes digitally. These were collected between the 23rd of March and the 4th of November, whilst the general population diaries were completed between 4th of May and 4th of November. The diary for the general public and the COVID surveys were promoted through social media, a Dogs Trust newsletter, coverage in New Scientist magazine, and by contacting current and previous research participants who consented to being contacted about future research. Generation Pup participants were reminded to use the existing diary feature via an email. Our methods of data collection generated a combination of quantitative and qualitative data. From the first survey, we analysed responses to open-ended questions regarding concerns related to dog ownership and responses to closed questions on concerns regarding the availability of veterinary care. From the follow-up survey, we analysed responses to 2 open-ended questions about concerns related to dog ownership and experiences of accessing veterinary care. And we also looked at the responses to closed questions about seeking and accessing veterinary care for preventative and acute health needs. Our analysis of the quantitative data was conducted in R, whilst the qualitative data we collected were analysed using a reflexive thematic analysis with support from NVivo software. Following data cleaning, we had 5,063 responses to our first survey. Across our diary studies, we had a total of 1,191 entries from 359 unique diary respondents. Our follow-up survey generated a further 2,537 usable responses. Across the surveys and diaries, most of the respondents were female. The most common age group of survey and diary respondents was 55 to 64 years of age. Findings from the first survey revealed that the potential availability of veterinary care concerned 1/3 of respondents. However, the subsequent follow-up survey found that contact with an owner's veterinary practice was obtained in 99.5% of cases in which this was sought since the start of the lockdown. Findings of our follow-up survey revealed that 22.2% of respondents had experienced a remote consultation, i.e. a consultation by telephone, video or email, since the start of lockdown. Although most respondents reported they were able to access veterinary care when it was needed, the follow-up survey showed that routine prophylactic treatments were often delayed or cancelled, reflecting the early lockdown restrictions on veterinary practices and subsequent delays. Delays or cancellations affected 28% of dogs that owners planned to neuter. 17.8% of respondents said that neutering was cancelled due to COVID-19, whilst a smaller proportion reported that the procedure had taken place but had been delayed. Regarding vaccinations, 10.5% said they had been unable to vaccinate their dog due to the pandemic. A further 1/4 of respondents, 23.7%, experienced delays in vaccinating their dogs. Moving on to our qualitative findings. Overall, our respondents described considerable variation in the measures in place across time and between practices. Respondents reported that waiting outside of the practice to be called in for a consultation was common, as was wearing face coverings and sanitising hands. People also described contactless or distance delivery of services, including the collection of and payment for medications. For example, one person said, "I have phoned our vets. I have requested wormers and made the payment over the phone. They've advised me to ring them when I'm in the car park, and they will bring it to me." To adhere to social distancing and reduce the risk of COVID-19 transmission, many practices were offering car park consultations. Some consultations were conducted using telemedicine, as our survey found. Our qualitative findings suggest that this impacted on client-vet communication by making it harder for some respondents to understand their vet. One participant described it as very impersonal, how consultations take place at the car or in an outdoor yard. They went on to say that follow-up is by telephone and it all feels very rushed with little contact by the vet. Masks make conversations difficult and paying is done on the street. However, other participants thought that video consultations were helpful and reassuring. Some people thought that the pandemic didn't have much impact on how they accessed the vet. For instance, as one participant said, vets have been really good and been open throughout with just a few changes to practices. The main difference in the vet-client interactions during the pandemic was that during most consultations, dog owners were not allowed to go inside the practice with their dog. A minority of owners felt that this did not have an impact on their dog. A few owners actually thought their dog seemed better without them there. One owner said both of their dogs really enjoy going to the vet and will happily rush in without me, which is a great advantage during this COVID outbreak. However, many others were upset about being unable to accompany their dog. A number of owners stated that this impacted on their ability to ask questions and to fully explain the health issue to their vet. As one participant wrote, they found it more difficult to ask questions at vet appointments because I couldn't go in with the dog. Owners were also concerned about being unable to reassure their dog and thought that as a result of being unable to accompany the dog, the visit was more stressful for the dog than usual. For example, one person wrote that at his last visit for bloods, the dog seemed extremely stressed. Not being able to go in with him negatively affected him, and I don't want him to go through that again. Unfortunately, a small number of dog owners experienced having to euthanise their dog without being present, which was very distressing to them. As this person explained, "We had our dog put to sleep. It was very upsetting as we could not go into the vet surgery because of COVID-19 restrictions. Everything had to be done outside in a public car park. The dog was still treated very well by the vet. It was just distressing for us as we did not have much privacy." Echoing our quantitative survey findings, many dog owners expressed concerns about accessing veterinary services. For example, one owner said they had some slight concerns about how they would access good veterinary treatment if it were needed for their dogs. Overall, owners reported mixed experiences of actually accessing veterinary services, with many reporting delays. Most people were pleased with the quality of care they did receive. For example, one person said, "The vets are doing an incredible job in really tough circumstances." However, as a result of COVID-related restrictions and delays, some people reported poor quality of care. For example, one person said, "Because of COVID, we couldn't go into the vet with her. When the vet examined her, they couldn't find it," a suspicious lump, and said there was nothing wrong with her, but the lump is still there. Another person expressed their frustration with trying to book a non-emergency appointment, as they said, "I phoned for advice in May, but the nurse on the phone just seemed to want to get me off the phone and said it wasn't an emergency and had to wait. There was virtually no guidance on when non-emergency appointments would open, so it was difficult to plan anything." In conclusion, our study found that throughout the COVID-19 pandemic, the availability of veterinary healthcare has been a concern for dog owners. However, the majority of those who did need to access veterinary healthcare were able to do so, and most were happy with the quality of care received, including the use of telemedicine instead of face-to-face consultations. In addition to these positive findings, we also found that delays in access to preventative healthcare, and in particular spay or neuter surgery and vaccinations, were common. As a result of COVID-19 safety measures, some owners struggled to understand the vet, explain their concerns, or ask questions. Many owners were distressed about being unable to accompany their dog into the clinic. Some thought that the COVID-19 restrictions led to delays, difficulties for vet-client communication, and ultimately a lower quality of care. Our study has implications on vet-owner communication. The findings suggest that the importance of checking for owners' understanding after the consultation, in particular when these are conducted using telemedicine or when an owner is unable to accompany their dog inside the practice. Finally, our findings indicate that owners may be less distressed to let their dog go inside the vet practice unaccompanied if the owner has a strong prior relationship with the vet and if their dog had been socialised with the vet before. These findings highlight the importance of socialisation at the vet clinic to set dogs up for happy vet visits. This study was a large team effort, and this slide acknowledges the people involved. We're especially grateful to all the dog owners who took part. Thank you very much for listening. I'm very happy to answer any questions you might have, and if you'd like to get in touch, please send an email to research@dogstrust.org.uk or find us on Twitter, where the Dogs Trust research team are @DT Scholars. Thank you.